The new 100.9 The Cat, number one for New Country. It's Jake and Dana, 820 online, 109thecat.com, or Facebook, Twitter, and Instagram as well. It's Total Wellness Tuesday. It's another opportunity for us to get right in the world.
And make some right choices.
Yeah.
We try.
Healthy. It's all about the mindset, right? It's where your head is in the game, if it's in track or not. So days like this with Dr. Catherine Wells from ImageCare of Community Care Physicians, she's going to help us learn a little bit. It's not so much going to... Would it benefit me, Dr. Catherine Wells? Is this something that would benefit me as well? Or is this mostly for just women, right?
Well, this is Breast Cancer Awareness Month.
Yeah.
So if you have any women in your life, if you have a mother, a sister, a girlfriend.
Yeah, I do.
Friends,
I have
neighbors.
all those things.
Yeah, you get all those.
Yeah.
Exactly. So this does benefit everybody.
It's important that we all know at least information to create the conversation.
Exactly.
And then for men as well, I mean, there's the breast cancer for men, right?
And men can get breast cancer themselves, yes.
Yeah.
Men can get breast cancer. We don't screen men for breast cancer because it's so much less common. But, men can support women who we do recommend get annual screening.
Okay, that's a really good perspective. I like that.
Well, it seems like we keep going back and forth on what age to do this.
I know you're
yearly
getting frustrated about this.
I know because
off air we were just talking.
I remember it was always at 40, and then it seemed to jump to 45. Are we back down to 40 again?
Well, I think there has been a lot of very conflicting information.
Yeah.
It's been very confusing. Different organizations have sort of been changing their recommendations, and I think that's really a problem for women. All these different organizations, everyone agrees that the data shows we can save the most lives from breast cancer when we start screening at 40 and we screen every year. And we all agree on that. We save the most lives this way.
Yeah.
But some of the other organizations have decided, for whatever reason...
Who are these guys?
Yeah. Well...
Should we go take them down? Should we get them right now?
Get the clowns after them.
Get the clowns after them. Doc, what do you think?
Perfect. That's perfect.
Sorry.
Get them a target. No. Well, the U.S. Preventive Services Task Force, this is the main organization that maybe 5 or 6 years ago started looking at the data. And I think they made a judgment call and decided it may not be worth it to screen women in their 40s and save those lives. They made a judgment call based on anxiety. They felt that mammograms and the consequences of mammograms cause too much anxiety.
Consequences of mammograms?
Well, a mammogram... oftentimes, not that often, but sometimes we need to bring women back in for extra pictures to clarify something on a mammogram.
Doc, I don't like going to the dentist. I got to go. You know what I mean?
Well, that's the thing. I think a lot of women get that anxiety of what if they find something instead of thinking, let's find it now, and, prevent it, and help you if we do find something. It's the anxiety
the burden,
of
the unknown, the unresolved. I understand.
Right, exactly. Most of the time, the questions that we have from a mammogram are very easily answered with some extra pictures or maybe an ultrasound. So I think focusing on the anxiety that a mammogram can cause is really distracting from the issue, which is that we need to save lives, and by screening every year, we can catch things very early at a very treatable stage, much more easily treated.
I think that's, anxiety is only going to get worse and worse in life in general. And
that's true.
Generation after generation, it just seems like people have more anxiety for some reason, like now more than ever before. So what happens then in 20 years from now if we rely on that theory or whatever? You can't.
Right.
You have to save lives.
Right.
So that's why 40 years old that's the best way to identify anyway.
Now, is it you also is the insurance companies, are they stopping with allowing you to do the mammograms? Is that because we're seeing a lot of in different things? We were just walking down here, the EpiPen and the strips for diabetes. It's hard for insurance companies now to cover this stuff.
Point,
Are they covering? Is that why we're seeing some problems with people not going because health insurance won't cover this?
Well, the U.S. government has passed some legislation trying to ensure that women do get coverage for mammograms, despite these recommendations from the U.S. Preventive Services Task Force. So I think there are steps out there to try to make sure that women can get this covered. Every insurance company has a different policy, and it's always important to check with your company. But I think that, there are powerful people out there in the U.S. government who want to keep insurance coverage for this test because it is so important.
Now, and these tests don't take that long. Right?
That's true.
It's really not that long.
How long would it take for you to go get checked out, get the mammogram?
It's she can
Well,
tell,
I think
doctor.
a mammogram takes maybe 15 minutes to get all the pictures taken. It always takes a little longer to go to the doctor's office and fill out the paperwork
Sure.
and that kind of thing.
Right.
Yeah.
We need lobby time.
Yeah,
that's right.
we need lobby
time.
time.
You
You got to
look
look
at
through
lobby
the
time.
magazines, and they're really good magazines. I've seen them all.
All right,
so we're
then
talking an hour.
15 okay,
you know,
there you go.
Right.
hour tops at the time.
Yeah, and you know what? When you think about something like a mammogram and what that could mean, you know, if you're thinking full all the way around, that could be a little scary, right? But sometimes, always, you're better off knowing.
Yeah.
So find out if you're 40. Make that call. What's your first step? You just talk to your primary care physician?
Yes, your primary care doctor would give you a script or an order for a mammogram, and then you can call us at ImageCare, at the breast center at ImageCare, make an appointment. We'd be happy to get you in for a screening mammogram.
They've got the breast customer service in town. Do you like what I did?
Sure do.
Did you hear my joke, Doc?
I like what you did there.
He's
Thanks.
been waiting to have some type of joke to slide right in there. Yeah.
Perfect opportunity. Dr. Catherine Wells, thank you very much.
Thank you very much. My
From
pleasure.
ImageCare of Community Care Physicians, make sure you ask questions. And if you need more information, we'll post up everything that we know on our Facebook wall. Actually, it's nothing that we've studied. It's just from these subject matter experts. You don't want us to post the stuff that we know.
You do not. No, not. It's up there right now.
Go link up and trust these professionals. Dr. Catherine Wells, we'll see you real soon. We can't wait to have you back. Thanks for visiting us on Total
Thank
Wellness
you.
Tuesday.
Thanks so much. My pleasure.